She's literally on the phone with the FDA and the CDC like, you need to help us. You need to help us.
After almost a month of labs across the country being unable to test, the Trump administration finally made a decision it could have made weeks earlier.
On February 26th, the FDA and the CDC laid out the strategy, and that was that we would be able to get up and running by using the original test kit, but by throwing out the N3 component.
Overnight, with some crossing out of lines on some paper, the same test kits that have been shipped out to the state public health labs were functional. That amended EUA was Wednesday, February 26th. And you can watch the testing curve in the United States. I mean, it really didn't start going up until that week. Here in Washington State, at the state lab, they had positive results the very first time they performed authorized tests.
After desperate pleas from healthcare providers, the FDA also relaxed regulations and let manufacturers and hospital labs use their own tests. But it was too little, too late. The disease had spread to half the states in the country. And test kits were in such short supply that they were limited to patients who met rigid guidelines set by the CDC.
Early on, our testing was limited to people who had traveled from China or they'd had contact with someone who was known tested positive for COVID-19. So written in our guidelines, by necessity, because we had a strain testing supply, it was designed to miss community transmission, meaning transmission that happens throughout the community that's not connected to travel, that we know at some point is going to happen. And it's like we're looking in this area and we know that transmission is going to happen over here and we're going to miss it because we can't test for it.